Hello, this is Dr. Ignacio School with a presentation on Generalized Anxiety Disorder. This person looks clearly anxious. This is a small comic about anxiety, how anxiety feels, the thoughts in anxiety. So classification of anxiety disorder has been attempted by ICD-10 and DSM-5. There are anxiety disorder, phobic anxiety disorder, where anxiety is related to a specific object, agoraphobia, where the anxiety is related to going out in the public. Without panic disorder, in panic disorder there are discrete episodes of anxiety which resolves on its own. Social phobia, specific phobia, other anxiety disorder, panic disorder, general anxiety disorder, which we are going to talk about today, and mixed anxiety and depressive disorder. And DSM-5 also follow the similar criteria, similar classification. So what is generalized anxiety disorder? In generalized anxiety disorders, the symptoms are persistent and are not restricted to or markedly increase in any set of circumstances, in contrast to phobic anxiety disorder. So in phobic anxiety disorder, the anxiety is caused due to a specific agent, but in general anxiety disorder, no such specific agent is found. Anxiety is present nearly always, and the anxiety is fleeting and is associated with different objects at different time. This essentially means that in generalized anxiety disorder, the person is afraid of anything, could be afraid of anything, and the thing differs according to the point of time. What are the symptoms? So before you try to remember all the symptoms, remember what happens to you when you talk to your cross or when you have to face a viva examination. The symptoms that occur are exactly due to anxiety. The symptoms matches. So since this is a severe disorder, there should be at least a period of 6 months with prominent tension, worry, and feelings of apprehension about everyday events and problems. At least 4 of the symptoms out of the following and list of items must be present. At least 1 of the following from the autonomic arousal symptoms and 4 from other 22. So among the autonomic arousal symptoms, it is due to activation of the sympathetic nervous systems, which result in palpitation or pounding heart, accelerated heart rate, sweating, trembling or shaking, and dry mouth. Symptoms concerning the chest and abdomen include difficulty breathing, feeling of choking, chest pain or discomfort, nausea or abdominal distress. Example, churning in the stomach. So these symptoms usually mimic the symptoms of myocardial infarction. Symptoms concerning the brain and mind. The person feels dizzy, unsteady, faint or lightheaded. He feels that the objects are not real, that is derealization, or that oneself is distant or not really here, that is depersonalization. So derealization and depersonalization may be present. There is a fear of losing control, going crazy or passing out. There is also a fear of dying. General symptoms. There are hot flushes or cold chills. There may be numbness or tingling sensation. The symptoms of tension include muscle tension or aches and pains. There is restlessness, like a rabbit, and inability to relax. The person feels keyed up or on edge or of mental tension. There is a sensation of lump in the throat or difficulty with swallowing. Other non-specific symptoms are there is exaggerated response to minor surprises or being startled. There is difficulty in concentrating or the mind goes blank because of worrying or anxiety. There is persistent irritability and the person has difficulty getting to sleep because he worries too much. So what is the cause of generalized anxiety disorder? The generalized anxiety disorder is triggered by a stressful events. So it occurs in life when a stressful event has occurred. There are genetic cause and genetic risk factors. Early childhood experiences play a prominent part, and conditioning to anxiety to previously neutral stimuli. So there's conditioning. So anxiety occurs in normal people in response to very difficult stimuli, like when we see snake or tiger in front of us, then anxiety or fear is normal. But in people with anxiety disorder, it occurs to neutral stimuli. The anxiety has been conditioned to occur to a very neutral stimuli. And there is pathological coping and cognitive style, and some personality traits like the anxious avoidant personality type is more prone to generalized anxiety disorder. So what are the treatment options? They vary from medication to psychotherapy to self-help. So self-help and psychoeducation, self-help or guided self-help can be useful. It can be counseled by the psychotherapist. Relaxation training like yoga exercise, applied relaxation taught by a trained therapist, or modified Jacobson's relaxation technique. This relaxation training can be done to relax the mind and keep it limber. Cognitive behavioral therapy is also very useful. So medications. For short term, you can use benzodiazepine and buspirone to decrease the anxiety symptoms. But however, in long term, SSRI are usually needed. And to control the sympathetic stimulation, you can use beta adrenergic agonists like propranolol. So benzodiazepine. Diazepam 5 mg to 10 mg thrice daily can be used. It should not be prescribed for more than 2 to 3 weeks because benzodiazepine can cause dependence and addiction. It can also cause rebound anxiety on stopping the therapy itself. Buspirone is another short-term alternative, and benzodiazepines are usually used for performance anxiety. So when you stop benzodiazepine, then there can be rebound anxiety. More anxiety can occur. SSRI or selective serotonin reuptake inhibitor. They are used for long-term treatment. The examples are fluoxetine and paroxetine. They can decrease anxiety even after the stoppage of therapy. So after you use them for 6 months, then your normal level of anxiety may be decreased. And if the patients respond to medication, risk of relapse is also decreased. So reference are Oxford Textbook of Psychiatry, 7th edition, Kaplan and Sadok Synopsis of Psychiatry, ICD-10, DSM-5, and Bennett and Brown's Textbook of Clinical Pharmacology.